Well, welcome tonight to Headache School. I am Kendra Pham. I'm an assistant professor at the University of Utah, Department of Neurology, in the Division of Headache and Neuro-Ophthalmology. And today we are going to be talking about neuromodulation devices. So what are neuromodulation devices for headache and when should I use them? Before we get going, I don't have any disclosures pertinent to this talk, and we'll address a few objectives today. So the objectives for today are to discuss what is a neuromodulation device, what neuromodulation devices are available for headache, and how much do they cost, who may benefit from a neuromodulation device for headache treatment, who cannot use a neuromodulation device for headache treatment, what are the pros and cons of neuromodulation devices for headache treatment, and how can I get a neuromodulation device for headache treatment? So to start things off, what is a neuromodulation device? So a neuromodulation device is effectively a device that applies some sort of electrical stimulation to a nerve that then alters its activity. And it's used commonly in a lot of different areas in medicine. You could see it used for urinary incontinence, spinal cord injuries, Parkinson's disease, epilepsy, and headache. So what neuromodulation devices are available for headache and how much do they cost? So currently there are 5 neuromodulation devices available for headache. These include Cephally, GammaCore, Nerivio, Relivion, and Savidual, and I'll go over each of them. So Cephally is an external trigeminal nerve stimulation device. This basically stimulates the trigeminal nerve and desensitizes that nerve over time. So the trigeminal nerve is one of these main branches in this complex called the trigeminal cervical complex that we know is involved in experiencing pain from migraine. And so as you can see in this picture from the Cephally website, it's worn on the head and it has this kind of little sticky pad, and the device magnetizes to the sticky pad. You use it for 20 minutes daily if you're using it for migraine prevention, or you can use it for 60 minutes at onset of a migraine attack for acute treatment. When it was compared with a sham device, which is kind of like a placebo, it's a kind of a device that kind of mimics the device, but doesn't really actually do the function of the device. So it's one of the ways they research these things. Patients did have a reduction in pain intensity at 1, 2, and 24 hours compared to the sham. No prescription is needed in order to purchase this device. It ranges between $389 and $424 to purchase. FSA or HSA eligible, and it has a 90-day back guarantee. The $424 one is the version that connects to an app that basically just tracks metrics of use, but you can't actually control it with your phone. So a lot of people go with the less expensive $389 one. You do have to be 18 years or older to use this. The next device is GammaCore, which is non-invasive vagus nerve stimulation. And so this activates the vagus nerve with electrical stimulation to the neck, and by doing so, it blocks pain signals involved in headache attacks. This one, as you can see in this photo from the GammaCore website, you hold the device up to your neck and you run it for its set time. Often people feel a pulling sensation on their lip on the side that they're using it. This device can be used for migraine, cluster headache, paroxysmal hemicrania, and hemicrania continua. When it is used for acute treatment for migraine or cluster headache, you do 2 treatments of 2 minutes duration where there's stimulation at onset of the attack. And then when you're using it for prevention for migraine, cluster headache, paroxysmal hemicrania or hemicrania continua, you do two 2-minute stimulations twice per day as a preventive mechanism. This costs $598 per month. You can get up to $100 off per month, up to 1 year with their copay program if you are eligible for it. And you have to be 12 years or older to use gammaCore. Neurivio is the next device that we'll talk about. Neurivio uses remote electrical neuromodulation. And as shown in this picture from the Neurivio website, it's worn on the arm. And you use your smartphone to kind of control how much stimulation you provide. A signal is given to the nerves in your peripheral nervous system that effectively turns on a pathway that turns down central pain that drives migraine by triggering the release of serotonin and norepinephrine. And when this is studied, you know, it actually has interesting data. It's been looked at in women who are pregnant, pregnant women who use this device compared to pregnant women who did not use this device, and they had no change in birth outcomes. So we think it's safe to use in pregnancy. In adolescents, it has been shown to be equally, if not more effective than standard treatments such as triptans. And in adults, when they compare it again to one of these sham or placebo-like devices, more patients achieve pain relief and freedom from pain at 2 and 48 hours, and relief from their most bothersome symptoms such as nausea or light or sound sensitivity. For Neurivio, if you're using it for acute treatment of migraine, you use it for 45 minutes at onset of the migraine attack. And if you are using it for prevention, you use it for 45 minutes every other day. Neurivio is $49 as a trial period where you get 18 sessions. And then after that, it's $89 per month. But if you like it and you go with 3-month installments of it, it's $199. So it saves about $60 by doing that 3 months at a time. And this is also available for people 12 years and older. Relivion is another device. It is external combined occipital and trigeminal neurostimulation. And you can see this is worn around the head. It has contact points on the nose and the forehead, and then also on the back of the head. And this is from the Relivion website, this photo. This provides direct stimulation to branches of the occipital and trigeminal nerves. So similar to cephalate, desensitizes them over time. And in addition to the trigeminal nerve being one of those main nerves in the trigeminocervical complex, so is the occipital nerve. And as we know, those are involved in how people experience pain from migraine. Compared to sham, almost half of patients that used this had pain freedom at 2 hours. 75% had improvement in their most bothersome symptoms, such as nausea, light, or sound sensitivity, and about 3/4 of the patient had a reduction in their number of migraine days per month by over 50%. So 50% less migraine days per month than they had before. The company recommends using this for less than 80 minutes per day. And in terms of cost, this one does a trial period of 2 months that is $150. And then after that trial period, you can purchase the device for $650 additional dollars. And then the next device is Savvy Dual. This is single pulse transcranial magnetic stimulation, which is the mechanism by which it works. And it's held at the back of the head, and pulses are given. And so 4 pulses are given at onset of a migraine attack if you're using it for acute treatment, or if you're using it for prevention, 4 pulses are given twice per day. And this is, again, a picture from the eNeuro website, the company that has Savvy Dual. Savvy Dual, in their studies, almost half of patients had a reduction in their number of headache days by 50%. or more, and they used acute medications 3 days less per month than they otherwise would have been, and it may be helpful for people in migraine with aura. And this one is $395 per month, and it's available for people who are 12 years and older. So, who may benefit from a neuromodulation device to treat headache? Well, different people may benefit from this. So, people who desire to use non-pharmacologic headache treatments, or people who medications aren't working may like to use these devices and they may benefit from it. People who are limited with the medications that they can take, either because of medical problems that they have that limit that use, or because they can't tolerate them due to side effects. These may be good options for people who need to reduce their use of acute medication. So, if you recall, if we use acute medications to treat our headache disorders too frequently, around 10 days per month, we can actually worsen our headaches. So if people are using those medications more frequently, these may be a nice alternative to take the place of those medications. And then certain subset populations, it may be a good place as well. For example, adolescent patients have less FDA-approved medications that are available for them, but some of these devices are cleared for their use after the age of 12. And so a possible place for these patients to have another option to treat their headaches. And then in pregnant patients, at least with the Neuromodulation device, there's that data that was showing that there weren't any differences in the outcomes between women who had used the device during pregnancy and women who hadn't. And so at least for that device, we know that this probably can be used in pregnancy, and perhaps with others it can as well. So the other question is, who cannot use a neuromodulation device to treat headache? There are relatively few reasons why somebody could not use a neuromodulation device to treat headache, but there are a few that matter. For example, if you have another implantable medical device, such as a pacemaker, you would not want to use the device because the concern would be that the one device would interfere with the functionality of another device. People who have metal things in their head, shrapnel or something of the sort, for some of these devices can't use them. For example, the transcranial magnetic stimulation, because that uses magnetic stimulation. So we don't want to put a magnet on the head if there's metal in the head. For the Neuromodulation device, if you have uncontrolled epilepsy, it's recommended not to use the device. And then with the Relivion device, if you've had recent trauma to the brain or any facial trauma within the past 3 months or so, they recommend not using the device. So a few reasons why we can't, but not that many reasons why you couldn't try a device. And then, we always want to remember there are challenges with our pharmacologic therapies as well. These are our kind of standard medications that we use often, and often are good choices for people, though we do need to remember that some of these medications can have variable benefit, either within one person, where sometimes it works and sometimes it doesn't, or between people. Maybe sumatriptan, or the trade name Imitrex, works for you, but for your mother-in-law, it doesn't do anything. And so we do see that there is variability in that effectiveness. Medications can have side effects and they can have contraindications. So, a medical reason why somebody couldn't use that medication. And then, as I already mentioned, with the medications that we use for acute treatment, with most of them, there is this risk for medication overuse headache. And we certainly don't want to get in a pattern of medication overuse headache, because it makes all of the headaches harder to treat. So, when we think about these challenges, we have good treatments that are medications, but there are gaps in these treatments. And so these neuromodulation devices might be considered to try and address these gaps for certain people. But then we also have to think about, well, what are the pros and cons of neuromodulation devices? So a pro for a lot of people is that it's not a pill. Many people don't want to take a pill. They'd rather choose something that's a more natural approach. And so this doesn't involve taking a pill. In all of the different studies that have looked at these devices, there are really minimal adverse events or side effects. Across all devices, the most common adverse event you see is discomfort or skin irritation at the site where the device is being used. And some people may experience some dizziness, but that's really the main side effects that you see with them. And there have been no major adverse events with these devices. They don't worsen headache the more that they are used, or at least we don't think that they do. And so that sets them apart from some of our, or many of our acute medications that can do that. And then they're probably okay in pregnancy. And as I mentioned, the Neurivio has data that shows that it is okay in pregnancy. The other devices don't have data looking at this. So we don't know for sure, but many headache providers are comfortable with their patients using neuromodulation devices during pregnancy. Now, as with any treatment that you would use during pregnancy, please also discuss this with either your OB/GYN or maternal fetal medicine specialist that you are working with to make sure they are okay with it also. What are some of the cons? So some of the cons, the data is less robust than studies for medications. It is harder to do good quality trials on devices. Often they are compared with a sham device, or they're compared against standard medication treatments. But there's not necessarily a lot of consistency across all studies in how these are done. And there aren't studies really comparing one device to another. So it's hard to say is one better than another. They undergo FDA clearance rather than FDA approval, which is a less rigorous process than FDA approval. FDA approval, in a sense, is looking for a medication to be both effective and safe. Whereas with FDA clearance with these devices, they're basically looking to see that they are safe to use, which is a good thing, but there isn't that same standard of efficacy. And then for a lot of people, the cost may be out of reach, and currently these devices are not covered by insurance. And so that is a limiting factor with using these devices. So with all of that information, maybe you're interested in a device. How do I get a neuromodulation device to treat my headaches? So for the most part, you're going to want to talk with your doctor that you're seeing and tell them that you're interested in trying a neuromodulation device to treat your headaches. The Cephaly device, you can actually go online to their website and order it. But all of the other devices require a prescription from your doctor. And so you'll want to talk with them about that. Make sure that you don't have one of those few reasons why you couldn't use one. Make sure it's the right decision for you. And then it could be something worth trying. And that is really all of the information that I have to share with you about neuromodulation devices for headache. So thank you. And hopefully you guys enjoyed this talk.